Hi, I'm Sue McKenzie, and I'm with Emily Jonesberg. We both work for Rogers Behavioral Health, and we're also members of WISE Wisconsin. We're here in this video and some others that we'll be doing to share with you some connections that we've learned between work we've done around compassion resilience in all sectors of our community and how it connects to this experience that we're all having in the COVID-19 pandemic.
This pandemic presents the perfect storm for compassion fatigue. That's what we're going to be talking about today in this video, the different stages associated with compassion fatigue, and a way in which you can help reduce your compassion fatigue. So I'm going to get us started with talking about the first stage and just see if any of these stages sound familiar to you. The first one is that of zealot. This is really a can-do mindset. Maybe you stock up, you get very enthusiastic about setting up your online virtual conversations with friends and family. You're excited about working from home, and you have a high level of energy.
Yeah, and then some reality starts to sit in, and we move into what the stages of fatigue refer to as the irritability stage. And that's really based on us recognizing some of the imperfections around us. You know, sometimes our leaders' messages aren't consistent. We look at maybe some of the things that are happening with some of our fellow citizens and wonder about them, or we even look at ourselves and we realize some of our own imperfections in managing a pretty stressful time. That leaves us in sometimes a place of cynicism or anger, and for many of us, our hopefulness starts to wane a bit.
Yeah. And you know, the more we learn, the more complicated this all seems and more overwhelming it becomes, which oftentimes moves us into the third stage, which is that of withdrawal. And maybe when you're in withdrawal, you start to sleep more, you start to disengage from others, you start canceling some of those video chats, and you just find it incredibly difficult sometimes to pull up the energy that you need to engage in some of the things you used to really enjoy.
Yeah, and then the last stage, and these of course don't come in a perfect cycle, we can kind of bounce around between them, but the last stage is the zombie stage. And that's really if we're not addressing our sense of the imperfections around us or the complexity of what we're dealing with, using some of the strategies we're going to talk about today and in future videos, you do almost a complete disconnection. You know, you don't want to be hit with that overwhelm or the too much information or the imperfections. And so you start to have a go it alone attitude. And unfortunately, as human beings, when we go it alone, we're rarely as effective as we'd really like to be.
Yeah. And you know, and Sue, in none of these stages are we really the person we want to be or our best selves. Maybe it's that we're seeing this pandemic as more of a sprint and less as a marathon. We really have to find balance among all the new changes and fear and confusion we may be feeling. But I really want to make sure I do say it is a normal reaction. If we're in any of these stages, or we find ourselves popping around between the stages right now or just in life in general, it's completely normal to do, especially when things are so complicated and complex.
Yeah, and yet there are some ways that we can intervene to help us not to be stuck in any of these stages, really just to be aware, I'm feeling overwhelmed today, and rather than totally withdrawing, what's something else that I can do in place of that? Lots of different strategies. Today we want to focus on one, and that is self-compassion. So one way for you to start realizing what it feels like to maybe not be as compassionate for yourself is to think about what you were feeling and thinking as Emily and I went through these stages. So 3 questions to ask yourself. As you were thinking about how you've handled things so far, were you maybe more self-judgmental or were you feeling kind to yourself? Were you thinking, gosh, I've really screwed up and you know, kind of move into that judgment from I'm the only one who screws up attitude? Or were you saying, yeah, little mistakes here and there. I'm like every other human on earth here doing my best. And then lastly, you can ask yourself, when I have these feelings, am I letting them really take me down? Or do I recognize that maybe I'm feeling overwhelmed and have some plan to do something about it? So do my emotions overtake me, or do they serve as a wake-up call that lead me into a different path, maybe a more healthy path?
You know, some concrete things we could say around building our own self-compassion practice, particularly when we've had a time where we've experienced embarrassment or anger or frustration, is we could start by saying, I'm sorry I'm feeling this way, and things are just tough. Things are hard right now. And then tell ourselves other people are experiencing this painful feeling as well, and lots of other folks understand where I'm coming from. And then ending that with, now that I know how I'm feeling, I've honored it, I've seen it, what do I want to do about it? Do I want to let it go, or is there a different kind of action that I want to take?
It's interesting to me, Emily, all the research points to, and certainly our experience of working with this concepts, is that when I practice self-compassion, I'm actually better able to offer compassion to the people in my life. And so it's kind of counterintuitive that when you want to reach out and provide good care, start by caring for yourself. Probably not a message that many of us got throughout our lives, and one for us to begin to practice. So that's one important strategy to help us all as we try to be compassion resilient as we face the times that we're living in right now. We'll be back with some more strategies. And in the meantime, if you'd like more information, on the screen, you'll see 3 websites that offer you some resources at this time. Thank you.